Hello and welcome. This is part of our handouts for our presentation, EFT at the Bedside, as presented at the AHNA 2021 virtual conference. I'm Mary, and my co-presenter is Patricia, and we would like to thank you for viewing our presentation. We hope you got a lot out of it, and that you find that tapping provides you with a new intervention that you can use to help your patients with some of those things that we can't give a pill for, or that don't need a pill. They just need somebody to help them work through it. So anyways, this is a very brief video that will help you just to review the tapping points and the sequence, because Patty and I both know that in order to learn EFT and feel confident using it, you have to be able to practice it, and you need sometimes to just look it up and see if you're doing it right, or to practice with someone else as you go forward until you feel comfortable. So we don't know exactly what kind of access you're going to have to the actual presentation, so we wanted to give you this opportunity to have this MP3. Or MP4, sorry. So let's begin. First, we're going to review the tapping points so that you remember where they are. And then we're going to go through the sequence. So beginning with the tapping points. Now, I learned by starting at the eyebrow point. Some people start at other points. As long as you're going through the SUD score and using the points in some order, you're doing clinical EFT as long as you go through the process as we described it. We really encourage you to stick with clinical EFT and not to adopt some of the more creative versions that are online, because we know that this has been researched. It's evidence-based, and we know that it has been found effective, sometimes very highly effective. So let's start with the tapping points. We're going to start on the eyebrow point. And when you tap on the eyebrow point, you feel the hair of your eyebrow, and you also feel your brow bone underneath. So you're going to tap on the inner aspect of your eyebrow gently. Tapping harder does not make it more effective. It just makes your face a little bit sore. And I can tell you this by experience. So next, you're going to tap on the side of the eye, and you're going to look for the corner of the orbit of the eye. You're not going to tap on the eye. You're not going to tap on the temple. You're going to tap right on that bone. I'm trying to give you landmarks so that you can share them with your patients. The next tapping point is under the eye. Now, I use 2 fingers for this because this one can be a little bit elusive. If you're looking straight ahead, for most people, this point is underneath the pupil of the eye, and it's on the bone, not in that soft area, but on the bone. You're tapping 5 to 7 times lightly on each point. You can stay longer on any point. If the patient feels or you feel as if you're getting some relief on a point, you can stay there longer, okay? But minimum of 5 to 7 times. The next spot is under the nose. And again, I, for some reason, use 2 fingers, and then in the crease underneath the chin. And all the while you're tapping, you are thinking about the words that you're repeating, not just repeating them, but thinking about them. The next point is the collarbone, and you find your sternal notch, and you find your collarbone. There's that angle there. You're going to go out by about 1 inch or 1.5 inches, and down by about 1 inch or 1.5 inches. You'll know it because it's a little bit tender. I also use the flat of my fingers to tap here because, again, this one can be a little bit elusive. It can be a little bit off of that spot. The next one, hopefully you can see it, is under the arm. For women, it's on the bra line. For men, it is at level with the nipple line. Tapping again and again, I use the flat of my hand. The last one is at the top of the head, right in the middle. Okay, when I was learning anatomy, they called that the bregmo, if that helps. Right on the top of your head, I use the flat of my hand. For the next round, you just go right back into the eyebrow point. So now let's look at the sequence. When you begin to tap, first you want to identify your issue, right? In our presentation, we used feeling overwhelmed. So let's stick with that one. Although we presented a lot of case studies with a lot of other opportunities, and the number of things you can tap on is endless. It's all individualized. So just remember that. Patient-centered, individualized care. So we start by identifying the issue, and it's overwhelm. We want to know how overwhelmed. We want to try to tap on things that are 5 or above on a scale of 0 to 10, the SUD score, similar to the pain scale that you're used to using. So one way to find this and to also validate your choice of issue is to say to the patient or to yourself, I feel overwhelmed on a scale of 0 to 10. How true is that? All right? And write that score down, because first we need a baseline, and second we need to be able to remember how bad we felt. This might sound silly, but it really truly does matter. All right, so we have I'm overwhelmed. We have a SUD score of 8, for example. Then we're going to do the setup statement. And the setup statement, as I said, is to prevent that thought sabotage, where you think this isn't really bothering me that much, right? Or I really don't have that problem, or I'll never get over this problem, right? So this is called psychological reversal. It reverses the polarity. We won't get into that, but this is important if you are in a self-sabotaging mode of thinking, all right? So the setup statement does have a standard setting, even though your problem, okay, and then there are several options. I completely and deeply accept myself. I choose to do whatever it is you're going to do, or I accept it, or I'm okay, or things like that, okay? It's kind of a negating that the problem is a problem. As you do your setup statement, you're going to tap right here on your karate chop point, okay? That's what they call it. So we're going to say, even though I feel overwhelmed, I choose to feel okay. Even though I feel overwhelmed, I choose to accept it. And you're thinking about that. You are really telling yourself this. Even though I feel overwhelmed, I'm okay. I can get through this, okay? So you can vary it. You can say the same thing 3 times in a row. The next thing to do is to go right into the tapping. And our reminder statement was overwhelmed. I feel overwhelmed. And I'm going to vary it a little bit just to show you a little bit about the variation. But we're also going to keep it very simple. This can become a very complex statement as you get more familiar and feel more confident with tapping. But we're keeping it simple, right? I feel overwhelmed on the eyebrow point. 5 to 7 times. Side of the eye. I'm very overwhelmed. Just very lightly. This is a sensitive part of your face. Under the eye. So overwhelmed. Thinking about how overwhelmed you feel. Under your nose. I feel overwhelmed. This is the thought of feeling overwhelmed. The voicing of it keeps you on track, and the thought is where you really apply it to how you feel, and that's what you're working on. Under the chin, or on the chin point, overwhelmed. On the collarbone point, I feel very overwhelmed. Now, I should put more emotion into this, but I don't really want to make this into anything other than an instructional thing. So, under your arm, overwhelmed. Top of the head, I feel overwhelmed, and it bothers me. Round 2, so overwhelmed. Now you can add a specific purpose or reason for feeling overwhelmed. So overwhelmed because I worked every day and I can't keep up. Specificity is going to make this more potent. Under the eye, very overwhelmed. Under the nose, I can't keep up. I'm so overwhelmed. Just keeping it simple, but you can be specific. On the chin point, I feel very overwhelmed. Collarbone point, I'm so overwhelmed. Under the arm, I'm very overwhelmed. Top of the head, I'm so overwhelmed. And at this point, maybe you have seen some signs of relief like yawning, sighing, relaxing of the posture. Maybe you have seen some signs of a change like increased agitation, crying, any number of exemplification of a change in emotion or feelings or physicality of it. And at that point, you can stop, have them stop and take a deep breath and rate their SUD score again. Go back to your notes and find out what to do if it is lower, higher, or the same. We've discussed that in the presentation. And then decide, do you want to let it go here because it's dropped way down and they're okay where they're at? Do you want to go forward with, I still feel overwhelmed? Or do you want to change it? Maybe they say, it's not as much overwhelmed as tired. And so maybe you can go at that again with a couple of rounds. Stop and do an assessment and see what happens. This is very simple. When I talked about the sequence here, remember that after you decide what to do, you want to do the planning part with the patients if we're thinking about that nursing process part. But you want to include the patient's words as much as you possibly can, because that's what their mind is going to grab onto. That's what they're going to think. Instruct the patient to let you know if they have a change, if they have a different thought come up, if they have a memory, or if the words aren't really what they would say, they should change them, and then you adapt, take their lead. So if you have questions or anything like that, you want to contact us, please take a look at the contact information, and please feel free. Always happy to talk to a fellow holistic nurse. Thank you. I hope you enjoyed this and that it was helpful.